Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. A fabulous review of vitamin C and immune function was published in the journal Nutrients in November 2017. Now, it may surprise you to know that vitamin C deficiency is the fourth leading nutrient deficiency in the United States, which is defined as a blood vitamin C level below 11 micromoles per liter. Now, reasons for widespread vitamin C deficiency include reduced intake of vitamin C containing foods due to poor food choices, combined with our body's limited ability to store vitamin C. So we actually need adequate amounts of vitamin C coming into our body every single day. As well, our need for vitamin C increases with exposure to air pollution, smoking, secondhand smoke, alcohol consumption, and drug abuse. And our vitamin C need and our vitamin C turnover also increases when we're fighting infections or facing excessive physical or psychological stress. Who isn't facing some of that? And when battling diseases with oxidative or inflammatory components. So for instance, people who are type 2 diabetics or pre-diabetics have more inflammation and oxidative stress, their needs are greater. And our immune cells in particular have a very high need for vitamin C. Some immune cells, like our neutrophils, concentrate values of vitamin C that are 50 to 100-fold higher than the amount of vitamin C that you would find in our blood. Within immune cells, adequate vitamin C is required for an appropriate and optimal response to help prevent or fight infection. So for example, the immune cells need vitamin C to migrate to the site of infection, stimulate immune cells to engulf and destroy viruses, bacteria, and other microbes. Also, vitamin C stimulates the release of free radicals to kill various microbes, and it also helps to induce programmed cell death and clearance of immune cells that have been spent in the fight against infection, which inhibits permanent tissue damage from occurring and helps resolve the inflammatory process as the fight against the infection winds down. So to make a long story short, studies suggest that the ingestion of 250 milligrams per day of vitamin C in otherwise healthy people helps to enhance many important aspects of immune function. The goal is to achieve a vitamin C blood level above 50 micromoles per liter, which most healthy people can achieve with a daily intake of 100 to 250 milligrams a day of vitamin C. Now, this can be very difficult to do from food alone, and thus vitamin C supplementation is an important consideration in achieving and maintaining optimal vitamin C status and immune function over our lifetime. Now, as we get older and our immune function declines, some studies suggest that the combination of 1,000 milligrams of vitamin C and 200 IUs of vitamin E each day improves immune function in people over the age of 60. So higher doses appear to be required as we get older. Studies also show that when fighting the common cold, supplementation with 200 milligrams per day of vitamin C can help reduce severity and duration and the incidence of the common cold if we're exposed to physical stress. This level of vitamin C intake may also reduce common cold frequency in those who have previously had lower vitamin C blood levels below 45 micromoles per liter. Very importantly, higher levels of vitamin C intake at 1,000 milligrams per day has been shown to prevent the decline in vitamin C depletion within white blood cells during an infection. So here's a quote from the research paper itself regarding lung infections, pneumonia, and vitamin C. So here's what they say. Beneficial effects of vitamin C on recovery have been noted in pneumonia in elderly people hospitalized because of pneumonia who were determined to have very low vitamin C levels. Administration of vitamin C reduced the respiratory symptom score in the more severe patients. In other pneumonia patients, low-dose vitamin C, giving them 250 to 800 milligrams a day, reduced the hospital stay by 19% compared to those who didn't get vitamin C supplementation. Whereas the higher dose vitamin C group, who got 500 to 1,600 milligrams per day, reduced the hospital stay by 36%. And vitamin C supplementation also showed a positive effect on the normalization of chest x-ray, temperature, and the erythrocyte sedimentation rate, which is a marker for inflammation and infection. So it improved all of those really important aspects of pneumonia. Since prophylactic vitamin C administration also appears to decrease the risk of developing more serious respiratory infections, such as pneumonia, it is likely that the low vitamin C levels observed during respiratory infections are both a cause and a consequence of the disease. End of the quote. What does this mean? It means that during an infection, vitamin C turnover occurs more rapidly as immune cells draw down on their vitamin C stores to fight the infection. And as the vitamin C becomes more and more depleted within our immune cells, they become less and less effective, allowing more serious infections like pneumonia to take hold and progress. As the researchers so aptly conclude, and I quote, "Thus it is apparent that vitamin C is necessary for the immune system to mount and sustain an adequate response against pathogens whilst avoiding excessive damage to the host, to our own body." Here's another quote from the review paper. "Following surgery, patients require relatively high intakes of vitamin C in order to normalize their plasma vitamin C status. They need at least 500 milligrams a day. And administration of antioxidant nutrients, including vitamin C, to patients with disorders in wound healing can shorten the time to wound healing." So patients that have sustained wounds, the wound heals faster when vitamin C is administered, along with some other micronutrients. With respect to histamine release in allergy sufferers, studies show that vitamin C supplementation between 125 and 2,000 milligrams per day can decrease histamine levels in allergic patients, helping to suppress their symptoms. And also, studies have shown that intravenous vitamin C at 7,500 milligrams has also shown really impressive outcomes to help suppress allergy symptoms in allergy sufferers as well. Remember that it's immune cells, eosinophils, basophils, mast cells that actually release histamine during an allergic response. So vitamin C affects those immune cells in a positive way. Vitamin C supplementation has also suppressed inflammation in type 2 diabetics and improved blood sugar regulation when ingested at a daily dosage of 500 milligrams twice a day. So that's in diabetics. Type 2 diabetics are known to have lower vitamin C blood levels, which also impairs their infection fighting and wound healing ability. Vitamin C is required for all of these functions. So in conclusion, most healthy individuals can help to optimize immune function with an intake of 100 to 250 milligrams per day of vitamin C. But when fighting or recovering from an infection, during wound healing, or battling conditions such as type 2 diabetes or allergies, higher daily vitamin C supplementation doses have shown some beneficial effects. Of course, you must always check with your physician before making any change to your diet or supplementation program, as vitamin C supplementation at doses described in this report can be contraindicated if you have certain health conditions. So I've included the research paper cited here in the text below. It's a fabulous review paper if you have a chance to read it. Thank you for watching, and I'll see you next time.